Hi, I'm Mabel Jong. Thanks for joining me. Right now I have Jeff Giadone in the studio. He's Executive VP of Public Sector at Alere Health. Thanks so much for being here.
Glad to be here, thank you.
Well, tell me a little bit about Alere.
Well, we are a leader in the total health management solutions for employers, health plans, and public sector, as well as a global leader in rapid point-of-care diagnostic devices.
Okay, so certainly you're talking to many different communities of people.
We are, absolutely.
And getting a real feel for what people are saying about the changing landscape of healthcare right now.
And it is ever-changing.
And are there concerns that some things will not be done as well as they should be, and deadlines and so forth, or what are people saying?
You know, I think everybody is, number one, scrambling and trying to figure it out. It goes state by state for the states that are participating in the expansion, participating in the exchanges. Not only from that, my focus and specialty within Alere is in public health, or in public organizations. And with that, it constitutes the employees of federal, state, and local governments, higher education, K through 12, labor and trust, as well as the dual eligible or the vulnerable population called Medicare and Medicaid. So really, to answer your question, yes, I think everybody is trying to, number one, meet deadlines, better understand what those deadlines consist of, and ensure that not only the physician community is also working very feverishly towards this, but the employer and, of course, the government sector are doing it all as well.
Okay, let's go back to the dual eligibles.
Right.
What is unique about this community of people?
Well, number one, the dual eligibles comprise about 9 million people nationwide, and it is those that are eligible for both Medicare and Medicaid, and also those that are characterized by being in the poorest of poor, homeless, hungry, and of course the elderly, with both from the Medicare side. Some statistics that we have uncovered in the dual eligible population is that 40% are diagnosed with a cognitive disorder as well as mental illness. And so and the dual eligible population continues to grow, and their healthcare costs are growing at exponential rates. And along that line, there's also a high incidence of other multiple chronic conditions that are also socially related, mental health related, and functionally related.
Okay, so we do know a lot about these people.
Correct.
What are health plans needing to do to address the needs of these folks?
Well, they're really needing to be ready to assess the risk, help to stratify that risk and identify it, and then be able to apply complex and case management conditions or programs to those to help them to manage that care. And really it focuses, what I think, in three areas. One, being able to assess that population to ensure that they have the care that they need, being able to get them to the right physician, to the right care at the right time, and that care is both of high quality and on an efficient basis. For the taxpayer basis, being that this is our tax dollars at work to help our fellow man to do this, is that it's both on an efficient level.
Right. Now you'll be addressing a panel tomorrow on,
yes,
on these people.
Correct.
What is your overriding message for them?
Well, one, this panel is really coming together to bring a variety and a broad depth of expertise and a focus really in helping to manage the population, meaning that, going back to what I just said about access and making sure that physicians have information and being able to assess that information to provide programs to help them to meet the needs that they have.
Are we there? Are we on our way to providing this yet, or we're just needing to start really from scratch?
There are several states that have demonstration projects in play already, and so I would say that we're on our way. We still have a lot to learn. We still, as a healthcare industry, I'm saying we have a lot to learn, and so things like the World Healthcare Congress here this week help us to uncover best practices, ideas, thoughts, and promote partnerships in which to help to tackle this problem.
Okay, Jeff, well, we're going to have to leave it there this time, but thank you for stopping by.
My pleasure, thank you.
I'm Mabel Jong. Thanks so much for watching.